Alright, basically the tailor tilt has two parts, has inversion and eversion. Basically, patient gonna be seated, the leg hanging off the table a little bit. All you're gonna do is stabilize the lower leg. Grab the calcaneus with the other hand. In a neutral position, invert the foot. That's testing for the CF ligament, calcaneal fibula ligament. And then dorsiflex the foot, still stabilizing. And invert the foot, and that's testing for the PTF. And then plantar flex, invert the foot, that's testing for the ATF. And then eversion is the same way. All you're doing is everting the foot, still stabilizing. Evert the foot, and that's testing for deltoid ligament sprain. So the implications for the eversion, tailor tilt test, you're going to have deltoid ligament sprain, and positive tests are going to be pain, hypermobility. Same with inversion, tailor tilt, hypermobility, and pain for a positive test.
Where'd you get those, the inversion, moving it into different positions?
I looked it up on YouTube.
On YouTube? I've never seen that before. I'm not sure if those are all correct.
Okay.
All right? That's nothing against you. It's just whoever posted it. Okay, because think of this. You guys, what's the ATF doing? What's its responsibility? I told you guys the other day. It's limiting anterior translation of the talus on the tibia and fibula. Okay, so by having it in that plantar flex position, unless you're pulling anteriorly, you're truly not assessing that. Okay, so the one thing I would add is when you do inversion, tailor tilt, the primary focus is a CF ligament. Okay, to my knowledge, there's no test out there that will assess for a PTF. All right. But I could be wrong. So, and Jasmine, I just gotta say that's the loudest I've ever heard. I could not be any prouder of you than you now. Awesome job.
Woo!
Now doing the Thompson test and the Omen sign test. So for the Thompson test, you're gonna have the patient lie on their stomach, prone. And you're going to have the foot leaning off the table a little bit. And what you're going for this one is you're going to squeeze on the calf muscle. And you're trying to get the foot to plantar flex when you squeeze. And if it doesn't plantar flex, that's a positive sign. And that would be for Achilles tendon rupture or another problem with the Achilles tendon. Something's not connecting there. And then for Homan sign, sitting there.
Hold on, let's talk about that Thompson test one more time. Everything you said was right, but here's what I want you guys to think of. If someone has a 3rd-degree strain of the Achilles tendon, is that foot going to plantar flex even though they have a 3rd-degree strain? Okay, I'm going to give you the answer. Yes, it will. Now I want to know why. The gastroc and soleus are gone. Once you have a 3rd-degree strain to the Achilles tendon, they're gone. So why would it still possibly plantar flex?
Two of the perennials plantar flex the foot if you're squeezing the lateral side.
Okay, possibly if you're squeezing the lateral side, but let's hypothetically say he was not squeezing the lateral side.
It's just because of the skin and how tight it is.
Nope.
The talus? Have to do with the talus?
Nope.
Nerve?